My philosophy of palliative care is we will do whatever we can do to ensure that our patients and families have as positive an experience as they can. And by that I mean whatever they want. You know, if they want to eat ice cream for breakfast or drink wine for breakfast, for goodness sake, then that's going to be fine. We have no rules. The families can come and go as they please. They can stay overnight. They can help with care or not help with care. They can do anything. It's important in this building that people have as good a quality of life as they can possibly have, that they come here to live until they die and not just wait to die, so to speak. And it's important to me that all of the staff and the volunteers who are here working in this building understand that and ensure that the focus of their day of work is on the patient and the family to give them what's needed, whatever that might be. I think it is experiencing the joys of life. So here today we're in this garden and we have beautiful flowers, we have hummingbirds, we have ducks that live in the garden, for goodness sake, that you can still experience that pleasure if you want. We have raised flower beds if they want actually even to get their hands dirty. We have music, we have movies, we have books, we have people, we have happy hour where we have a little social get together once a week for them. It's trying to maintain a sense of normalcy in what is really a very traumatic and difficult time for patients and families. I would say that it's important for them to be present, to be in the moment, to take themselves into that space with the patient. So if the patient's upset and crying, that's okay. If they're not, that's okay. It's all about just living in the moment, not being somber, not being sad, and just treating them as normally as you can, as if, well, it's not as if they're not dying, but dying is not the most important piece of who they are at this time, perhaps, that who they are as a person and how they interact with the world is what's important. It's listening, it's just being open and honest, and it's respect, it's loving, it's honouring, right? It's just being in the space with the patient. We have not a lot of cultural diversity in our community as a whole, but from time to time we do have people of different cultural backgrounds, and I think we try really hard and we encourage our staff really hard to find out as much about the different cultures. So if it's a First Nations family, what's important to them as a culture? If it's Japanese, we have a number of Japanese people, same thing, find out what's important. We've had different cultures, different people of different faiths who have been in our building, and we have tried really hard to honour their wishes for the end of life journey. For example, can we talk about the Baha'i faith, where the bathing was really important at the point of death, and the staff went out of their way to ensure that this was going to happen for this family to be able to bathe their loved one at the end of life. That's really important. Dignity is huge. As a young nurse, I remember being told, come into the hospital, you leave your dignity at the door. And that philosophy, fortunately, has changed over the years. And especially in this kind of environment where people are sick. They are sick and they're frail and they have a very different body image than they did sometimes even just a short while ago. And to help them feel as good as we can in how they're looking, I suppose, and what their appearance is important, because we will all die with dignity, and that's what we want. A good death is whatever the patient wants it to be. It's not my judgment, it's not your judgment, it's whatever the wishes of the family are. So if it was me, I'd be quite comfortable dying in a bath because I love being in the bathtub. But for some people, it's being surrounded by their loved ones. For other people, it's being alone. They don't want to have people around. For some people, there are certain rituals and ceremonies that are important leading up to the end, and for some, it's not until after the passing has happened. So a good death is whatever you say it is, in actual fact. When we hire new staff, I say to them that 80% or so of their time will be spent in the one-on-one conversation piece, and 20% will be on the symptom management piece. And that's not saying I don't want you to think it's not important, because unless you can do both things equally well, we have nothing. The nurses who work here have to have excellent assessment skills and excellent knowledge of pain and symptom management, the medications that we use, the comfort measures that we use, whether it be traditional medical or something of the more holistic view, whether it's a fan to help them to breathe a bit better or to open a window. It's vitally important that we have that piece, because without that piece, all the conversation in the world isn't going to do any good, and vice versa. If you can't do the conversation, all the pain and symptom piece, you need to have a really good blend of both things.